If amlodipine or losartan is in your pill organizer right now, there are 5 specific things that can interfere with how that medication behaves in your body. And at least one of them is something you may have done this week without giving it a second thought. Not because anyone is hiding the information, because the appointment where amlodipine or losartan was prescribed usually had a different priority. The dose, the reason for taking it, the blood pressure reading, perhaps one common side effect. And then the conversation moved on. What often does not get covered is what happens when that medication meets a low-sodium salt substitute, a tablet for a sore knee, a stomach bug during a hot week, half a grapefruit at breakfast, or a quiet decision at home to change the dose yourself. Individually, each of those sounds unrelated to a blood pressure medication. Together, they explain a surprising number of the side effects, unstable readings, and avoidable scares that happen in people who were otherwise doing exactly what they thought was the responsible thing. Amlodipine and losartan are both widely used, well-studied blood pressure medications, but they work in different ways. Amlodipine is a calcium channel blocker. It relaxes and widens blood vessels. Losartan is an angiotensin receptor blocker. It blocks the action of a hormone that tightens blood vessels and affects fluid balance. Both are effective. Both are commonly taken for years, and both work best when the conditions around them remain stable. My name is Dr. Clara Hoffman. Before we continue, do not stop, reduce, increase, or restart either medication based on this video alone. Everything I describe here is information to discuss with your own prescribing clinician, not a decision to make independently. I am going to walk you through 5 specific things to avoid, the reason each one matters, and what to do instead. Stay with me through all 5 because the 5th one is the one that quietly turns the first 4 from manageable issues into bigger problems. I want to tell you about a patient I will call Martin. He was 72, retired, organized, dependable, the kind of person who never missed an appointment and almost never missed a tablet. He was taking losartan every morning and amlodipine every evening. Over the course of one ordinary week, several things happened that seemed harmless at the time. By the time I saw him, 4 of the 5 things I am about to describe had happened within days of each other, and the result was a blood pressure situation that frightened him, a set of lab results he did not expect, and a problem that was, in the end, avoidable. 5 things. As I go through them, notice something. None of them sounds dramatic. A healthier seasoning, a pain tablet, a hot day with a stomach upset, a fruit juice, a decision made quietly at home. That ordinariness is exactly why they matter. People naturally become cautious around things that feel dangerous. These do not feel dangerous, so they slip past attention. Thing 1, potassium-based salt substitutes and potassium supplements, especially if losartan is the medication in your routine. This is one of the most common traps because it often begins with a person trying to do something healthier. They are told to cut down on salt, so they buy a low-sodium salt substitute. Or they begin a hydration mix, an electrolyte powder, or a supplement for leg cramps without checking what is in it. Losartan works partly through a hormonal pathway that affects how the body handles potassium. That means potassium can build up more easily in some people, particularly if kidney function is not perfect, if dehydration is present, or if other medications that also raise potassium are in the picture. The problem with high potassium is that it often stays silent until it is not. Some people feel nothing at all. Others notice unusual weakness, heavy legs, muscle symptoms, a strange awareness of their heartbeat, or a sense that something just feels off without being able to name it clearly. Think of potassium like electricity. Your heart depends on very precise electrical timing. Too much potassium can disturb that timing. The person thinks they made a heart-healthy choice by switching to a low-sodium product. But if that product is replacing sodium with potassium and losartan is already changing potassium handling in the background, the result can move in the wrong direction. What to do instead? If losartan is part of your routine, Do not assume that low sodium automatically means safe. Turn the container around and read the label. If it says potassium chloride, that is not a neutral swap. The same applies to over-the-counter potassium supplements and many electrolyte products. If you want to use any of them, check first with your pharmacist or prescriber. The second thing on this list is sitting in medicine cabinets all over the world, and most people do not think of it as a blood pressure issue at all. Thing 2, regular NSAIDs, ibuprofen, naproxen, and sometimes other over-the-counter anti-inflammatory pain tablets taken repeatedly for joint pain, back pain, or headaches. This matters for both medications, but it matters especially if losartan is involved. NSAIDs can reduce blood flow within the kidneys, encourage sodium and fluid retention, and make blood pressure medications work less well. In plain language, the tablet you are taking for your knee can quietly make the tablet you are taking for your blood pressure less effective. And in some people, especially older adults, people with kidney disease, or people who are already a bit dehydrated, that combination can put real stress on the kidneys. Think of it this way. Your blood pressure medication is trying to keep the system relaxed and controlled. Regular NSAID use pushes the system in the opposite direction, not always dramatically, often gradually, which is why people miss it. The patient starts taking ibuprofen most evenings because the shoulder hurts. 2 weeks later, the home readings are higher. A month later, the ankles are puffier, the pressure is less controlled, and nobody connects it to the pain tablets because they were bought without a prescription and felt routine. What to do instead? If you need pain relief once in a while, ask what option is safest for you specifically. If you need pain relief regularly, that should be a medication conversation, not a silent over-the-counter habit. In many cases, alternatives such as paracetamol or a topical anti-inflammatory gel may be considered, depending on your medical history. But that decision belongs in a proper discussion. Thing 3, dehydration, especially when it arrives disguised as something temporary. A stomach bug, vomiting, diarrhea, a very hot day, hours in the garden, fasting before a procedure, not drinking enough because you are busy or simply not thirsty. People often think of these as separate from their blood pressure treatment. They are not. Losartan lowers blood pressure in part by blocking vessel tightening signals. Amlodipine lowers blood pressure by relaxing blood vessels directly. If your circulating fluid volume falls at the same time because you are losing water, sweating heavily, or not replacing fluids properly, the medication that is normally well tolerated can suddenly feel too strong. That is when dizziness becomes more likely. Lightheadedness when you stand, weakness. A feeling that you need to sit down right now. And with losartan in particular, dehydration can also raise concern about kidney stress because kidneys depend on adequate blood flow and fluid balance to work well. Think of your circulation like a hose. These medications change the pressure inside the hose in a controlled way, but if there is suddenly less water moving through the hose at the same time, the balance changes. The same dose that felt completely normal on Monday can feel very different on Thursday if Thursday came with vomiting, diarrhea, heat, or poor fluid intake. What to do instead? If you are ill with ongoing vomiting or diarrhea, if you are suddenly sweating heavily in heat, or if you are preparing for a procedure that changes your eating and drinking routine, do not just push through and assume your tablets are irrelevant. Contact your doctor, pharmacist, or practice nurse for advice. And if you feel dizzy, stand up slowly rather than springing to your feet. Tell me in the comments right now, has anyone ever told you to avoid salt, but never explained the difference between sodium and potassium? Type yes if yes, because thing 4 is the one many people think they already know, but very few apply consistently. Thing 4, grapefruit and grapefruit juice, particularly if amlodipine is the medication in your routine. This one sounds small. It is not. Amlodipine is processed through pathways that grapefruit can interfere with. In practical terms, grapefruit can increase the chance of side effects from amlodipine, not in every person to the same degree, and not every single time in the same way, but enough that it should not be treated casually. What does that look like in real life? A person who is doing fine on a stable dose starts noticing more flushing, more dizziness, more headaches, more palpitations, more swelling, and assumes the medicine has suddenly turned on them, when in fact, the issue may be what has changed around the medicine rather than the medicine itself. The reason this catches people off guard is that fruit does not feel like an interaction. Fruit feels healthy, juice feels harmless, and yet one of the most ordinary breakfast habits can be the thing nudging a stable medication into side effect territory. What to do instead? If you are taking amlodipine, avoid grapefruit and grapefruit juice unless your own prescriber specifically tells you otherwise. If losartan is part of your routine too, that is not a reason to treat grapefruit casually either. The safest habit is simply not to mix grapefruit into the routine around these medications. Now we come to thing 5, and this is the one that makes the first 4 more dangerous than they initially sound. Thing 5, changing the dose yourself. Skipping it, doubling it, stopping it, restarting it, or deciding to take a break because of a symptom, a reading, or a missed day. This is where ordinary side effects and ordinary misunderstandings become actual risk. A person develops ankle swelling on amlodipine and quietly stops it. A person on losartan has 2 high home readings after a week of ibuprofen and decides to double the dose. A person feels dizzy after a day of vomiting and heat and skips both tablets for 2 days without calling anyone. A person forgets yesterday's dose and takes 2 today to catch up. All of those feel practical in the moment. None of them is the right way to handle it. These medications are designed to work through consistency, not through rescue use, not through improvisation. A missed dose should not be chased by doubling. A side effect should not trigger a silent medication holiday. A high reading after several days of pain tablets, dehydration, or stress should not trigger dose changes made at the kitchen table. This is what happened to Martin. He had recently switched to a salt substitute because he was trying to be better about blood pressure. He had been taking ibuprofen most evenings for hip pain. Then came a hot weekend, some time working outside, poor fluid intake, and a day of stomach upset. He felt dizzy the next morning, saw a home reading that looked strange, and made what seemed to him like the safest choice. He skipped both medications for the next 2 days. By the time he came in, he was frightened. He thought the medicines had become dangerous for him. In reality, the medicines had not suddenly changed. The context around them had changed, and then he changed the dose himself in response to symptoms that actually needed a phone call, not a home adjustment. What to do instead? If you miss a dose, follow the instructions you were given and do not double the next one unless you were specifically told to. If swelling, dizziness, weakness, or unusual readings appear, do not rewrite the prescription on your own. Call. Explain what changed. Mention the pain tablets. Mention the stomach upset. Mention the low sodium salt. Mention the grapefruit. The detail you think is irrelevant is often the detail that explains everything. 5 things. A seasoning shaker that looked healthier than it was. A tablet for a sore knee. A day of fluid loss treated as if it had nothing to do with blood pressure medication. A breakfast juice. And a private decision to change the dose without telling anyone. None of those feels dramatic in the moment. That is why they matter. Amlodipine and losartan usually do exactly what they are supposed to do when they are taken consistently, and when the hidden variables around them stay in view. The trouble begins when the background changes and nobody notices that the medication is now operating under different conditions than the ones it was prescribed into. If amlodipine or losartan is part of your routine, the goal is not to become anxious about everything. The goal is to recognize these 5 specific problems early enough to avoid them. One final detail. If you are due to have a medical or dental procedure that changes your usual eating, drinking, or medication schedule, ask ahead of time how your blood pressure tablets should be handled that day. Do not wait until the morning of the procedure to guess. Which of these 5 was new to you? Tell me in the comments. I read every response personally. Share this with someone who takes amlodipine or losartan, especially if they have ever used a low-sodium salt substitute. taken ibuprofen regularly, felt dizzy during a stomach bug, or quietly changed a dose without calling. In the next video, I am covering the 5 things to avoid if you are taking lisinopril, including one interaction that people confuse with losartan all the time. Most people watch a video like this and forget the channel exists by tomorrow morning. If this helped you, subscribe now while you are thinking about it. This is Dr. Clara Hoffman. 5 ordinary things, 2 common medications, 1 safer routine. I will see you in the next one.